Hi, I'm Kobe. I'm a UK osteopath at soothclinic.com. In this video, I'm going to start the very big and long job of addressing spinal disc injury management and what you can do to help get yourself back to 100% recovery. The good news is that with all forms of disc injury, be it a prolapse or a herniation or a bulge, which is the same thing, or a simple annular strain or tear, exercise prescription plays a very large part in ensuring 100% recovery. The only thing is that the exercises and the entire management program is very different for a prolapse than it is for a disc bulge, than it is for a strain or a tear. In this video, I would like to address disc herniations, disc bulges. So that is where the disc tears and the jelly inside moves through that tear without breaching the surface of the disc, and the disc bulges. It may or may not hit a nerve, so you may or may not get pain in the legs or in the arms. I'm just going to be looking now at the bulges. It doesn't matter if they've hit a nerve or not, but you do need to know which direction your disc has bulged. I'm just gonna give you a couple of very simple exercises just to get you started and to get the ball rolling. There is absolutely masses more that you can do, which I will try to address in my future videos, and also you really need to be under the care of a manual therapist. So the goal with the rehabilitation of a disc bulge or herniation is to get that disc completely back in position and off any nerve or structure that it might be hitting. This can happen very quickly, and within 2 weeks you should be able to get that bulge back in. The problem happens is people do the incorrect exercises, or they don't do any exercises at all, or they continue lifting or not taking the correct advice, not taking a break from heavy building work or heavy lifting work. So what I'm going to give you now is just one quick exercise. Depending on which direction your disc is bulging will determine which exercise you should do. So if your disc has moved forwards, then you need to be doing a forward bend movement. That will encourage the disc to move back into the central position. If you do any back bends, that a disc will be bulged out and it will actually aggravate the disc. So that's why it's so important that you get a scan and you know exactly which direction your disc has moved. So very simple exercise if your disc has moved forward and you want to push it back into the central position is just what we call the child posture. So you just want to come forward like this and then just ease yourself forward into this child posture here, collapsing your chest onto your thighs. You can rest here. You can also maybe I don't have one here, but you can place a cushion under your forehead and just rest there for as long as you like. You will find your low back muscles will likely be in quite a lot of spasm, and this will also help to stretch out those muscles, and so will release that pain that you're experiencing from that spasm. So to come out of this, you need to carry all the weight through your arms, so your back muscles don't have to do any work at all, because they are at high risk of spasm if you have an active disc bulge. So just gently walking your hands towards you, all your body weight through the hands. Ease yourself up, hands onto the knees, and just walk yourself up your legs to a sitting position. The goal being to keep your back muscles completely relaxed and not having to do any work. A second way to achieve this position and get immediate pain relief often, if you can get the disc off the nerve, is to lie on your back and do some simple knee hugs. Obviously you'll be moving a lot slower than I'm moving. I realise I'm moving a lot faster than you will be moving. So just lying on your back in this position and just drawing the knees towards the chest. There we go. You can also just draw the head up, although that may place quite a lot of strain through the nerve, so best if you just relax and just draw the knees, and you can quite literally stay here as long as you like. There we go. To come out of this position, you would need to roll onto your side. Nice and slowly, place your weight down through your hands and gently walk yourself up into a sitting position again. Obviously, if you do have a disc bulge, you are presumably avoiding sitting as much as possible. So if your disc has moved backwards and is bulging backwards, whether or not it's hitting a nerve, you need to take your spine into a back bend so that it pushes the disc forward and back into the central position. So the best way to do this is doing a position we call the Cobra. So again, moving nice and gently, nice and slowly. Just bring yourself forward into the all fours position. Bring yourself down into a lying position, moving nice and slowly with complete control. Bring your hands underneath your shoulders as your head faces the floor. Now you need to completely relax your feet, your calves, your thighs, and your hips and pelvis. Just completely relax your back. The one point about this is you will, as I said before, I'm going to come up so I can speak to you properly. You will most likely have quite a lot of spasm in the surrounding muscles in your low back. So when you do this position, it is possible that you may set off a slight spasm. Unfortunately, you got to do this position. This is the only way, the exercise position, that will push that disc back into position. So what you can maybe do is just some gentle massage on those muscles before you do this exercise, just to bring that tension levels down just enough so that you can minimize the chance of spasm, or at least reduce the amount of spasm that you get. So coming back to this exercise, bring your hands under the shoulders, push all your weight down through the hands, relax the back, relax, 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 and just push up and hold there. You can hold this for a count of 10 and then release. And you want to do that basically about 5 or 6 times, at least every 2 hours. To come out of that, we're just going to push down through the hands. Remember, all your weight goes through the hands, and arms do all the work. Your arms push you back, your arms walk you back. Try not to go into a forward bend. So you've got to try and get yourself back into a seating position without putting too much flexion through your spine. Obviously, another way that you can come out of this position would be just to roll onto your side as such, draw your knees up, and then push yourself up, relaxing your back muscles, pushing yourself up into a sitting position. So that's just 2 very simple first aid exercises that you can do immediately today to start moving that disc back into position and start getting rid of that leg pain that you might be experiencing. Obviously, the complete rehabilitation of your disc requires quite a much broader spectrum management plan and a lot more exercises, but those are the basic standard exercises that you need to understand, because one of the inhibitory factors in disc recovery is people doing the wrong exercises, so doing the complete opposite. So instead of encouraging that disc back into position, people are actually rebulging it. So that's why, even though this looks very simple, it's a crucial key to your 100% recovery and correction and healing of your disc bulge.